case involved a woman who went in to have surgery, to have a hysterectomy. And during the course of the procedure, the surgeon unfortunately nicked the patient's bowel, which is a complication of the procedure. And following the procedure in the recovery room, the patient was showing very clear signs of being sick. She was developing a fever. She was getting sweaty. She was in a lot of pain, and the nurse was calling up the doctor to report the symptoms. And the doctor sent a resident to see the patient. And the resident, who's a doctor in training, examined our client and documented all of the classic signs that the patient had. What's called a surgical abdomen. She had tenderness, she was sweaty, she had a fever. And the resident wrote down that he was considering malingering or faking as one of the causes for the patient's symptoms. And the resident did not notify the attending of what the signs were that he had actually seen at the bedside. And tragically, the patient died of the postoperative complications. And the thought of looking at that note the very first time and seeing that the resident had called into question the honesty or the truthfulness of our client's mother who died with the suggested malingering has always stuck in my head, which I never can understand why that doctor thought that. At the deposition, he did not give a very good explanation as to why he put that in the chart, tried to backpedal and say that he was only just saying that's a consideration, not what he thought. But end of the day, the case settled in our client's favor with a very good result.